Telehealth became a vital part of healthcare during the pandemic, but these services were around before COVID took hold. Medicare relaxed telehealth restrictions to make doctor visits safer, but policies are now shifting. The national COVID-19 public health emergency will be ending soon, which concerns some medical providers about how this will affect the accessibility of telehealth. Dr. Emma Julu is a psychiatrist with Elbow Woods Memorial Health Center in Newtown, but lives in Texas. For 3 weeks out of a month, he meets clients digitally. He says while he likes in-person visits, they're not convenient.
A lot of the benefits far outweigh the negatives when it comes to telehealth visits. And like I said, I think is the wave of the future. I think it's here to stay.
The Biden administration had planned to end the COVID-19 public health emergency in May, though the U.S. Senate passed the bill last week to end it earlier, sending that to the president's desk. The president has said he disagrees with the bill but would sign it. The administration has extended telehealth flexibilities through the end of next year.